Welcoming a new baby is a beautiful experience, but it also brings a lot of challenges to your body. Today, I'm discussing how new mothers can safely and effectively get back into shape postpartum. So let's dive into the common postpartum issues, essential precautions, and a tailored exercise plan for each stage of recovery. Hey there, and welcome back. If you're new here, I'm Dr. Abby Siler, a physical therapist, runner, and mom who specializes in treating runners so you can get back to doing what you love without the drama of injuries or pelvic floor issues, especially as postpartum runners. Also, make sure to watch the end because there's so much information and more to come. Okay, so postpartum. There's a difference between the fourth trimester and postpartum. Everyone in the fourth trimester is postpartum, but not everyone that is postpartum is in the fourth trimester. Keep in mind that the fourth trimester lasts for 3 months. Postpartum is for life. So you are postpartum once you have a baby, forever. That keeps going on. I thought that tidbit was interesting when I learned it and when I realized that, and it makes such a different mindset for me as well. So anyway, back to the topic at hand, how to get back to running postpartum and in your fourth trimester safely, effectively, and without causing any issues or injuries or having pelvic floor issues such as leaking that everyone in our older generation say, oh, it's normal. Ladies, it's not normal. It's common, but it's not normal, and it's not something that you need to deal with. Okay, we'll just get that out of the way right here. So in the first 1 to 2 months after childbirth, the focus is going to be on healing. This means allowing adequate time for any vaginal tears or cesarean wounds to recover before starting any type of strenuous activity. 1 to 2 months after having the baby is a time for rest and healing. Don't even think about trying to get back to running for the most part. Some runners are able to do it before in that time frame, especially the pros, but we're not going to compare ourselves to the pros. We want to do this safe and calmly and actively and healthy because that's what we want to be for our kids. And we don't have the time that some of these other elite runners have to do the things that they do to get back to running so quickly. So during this early stage, you're going to introduce gentle stretches held for 30 to 60 seconds to increase blood flow and aid in healing. I want you to practice diaphragmatic breathing to re-engage your core stabilizers like the transverse abdominis. You want to, when we are pregnant, we spend a lot of time with a big old bulge in our belly, making it hard for us to breathe and breathe correctly, which is diaphragmatic and through the stomach. So we become chest breathers. We don't want to be chest breathers. It causes all sorts of problems and it makes it harder to breathe when we're running. So practicing nice diaphragmatic breathing helps retrain our bodies to breathe right. It's also a great relaxation technique to help reduce the stress and just kind of recenter ourselves in this crazy life of having a newborn baby at home. We also want to start doing light activities such as short walks, yoga with cat-cow flows, and chest wall mobilization stretches, which can help restore mobility and posture without overstimulating your healing body that you're having with this new phase of your life. So then, after the first 1 to 2 months, we're moving into the mid stage of recovery and postpartum return to fitness. Around 2 to 3 months postpartum, it's time to focus on core and pelvic floor re-education. This involves exercises that help restore proper activation patterns in your deep stabilizers, in your core, and in your pelvic floor. You're going to want to start with exercises like clamshells, glute bridges, and light modified plank variations. We want to combine these with Pilates-based breath training to enhance support, synchrony, and improve core stabilization. These exercises help rebuild strength around your low back and pelvis without straining the healing tissues that you have in those areas. Again, keep in mind, most women aren't ready. This isn't a hard and fast rule, but most women are not ready to start high impact activities such as running until the 3-month mark at the earliest. Even if your OBGYN clears you at 6 weeks to return to activity, they do not mean the high impact stuff. They mean more of this gentle strength training, things like that, that we were talking about in that 2 to 3 month phase. There are certain things that you should be able to do before you even think about starting a running routine and starting any type of high impact activity. That's not to say from the 6-week mark to the 3-month mark, you can't do activities. Like I said, light activities such as walking, swimming, Bike riding with caution, because let's face it, things got a little messed up down there. Not messed up, but they're a little sore down there. So bike riding might not feel the best. Rowing machines are great because you're not having anything in putting pressure down there other than just sitting on your butt. There are those types of activities are great to do starting at the 6-week mark. But running, high impact activities, jumping, we really want to wait until the 3-month mark. So that way we can retrain all those muscles that I talked about before to be able to support you when you're running, when our insides are bouncing. Because let's face it, that's what happens during high impact running. Our pelvic floor and our abdominal supports our organs and everything there and helps keep things in line and keeps us from leaking and having organ prolapse. We also want to avoid that. So if we wait till that 3-month mark, but do all these things before the 3-month mark, we'll be able to really get back to running and those high impact activities without those normal things that postpartum women experience, according to some of the other generations that didn't have the knowledge that we do. So like I said, there are certain things you should be able to do before you start a running routine. In the description, you will find my free postpartum return to running checklist. And that's a great tool to use to see if you're ready to go and start running after having a baby. It's a great tool to use, whether you're in the 4th trimester or well beyond in your postpartum journey 4-6 years later. I can say this is my testimonial. I have a 6-year-old at this point of recording this video. And it wasn't until I started helping postpartum women return to running that I really got into the pelvic floor health. And I realized I had some issues. I didn't do the work it took. I didn't know. I had the resources, but I didn't know what to do. And I didn't pass that checklist. At 5 years postpartum, I did not pass that checklist. So I went through this program, this exercise plan to help regain the strength and the stability that I needed that I had lost during pregnancy and during childbirth to be able to run better. I was running, but I was having issues. I was leaking. I was having some pelvic floor pain, but mostly I was leaking and having incontinence, both with running, jumping, sneezing, coughing. And now a year later, after working through this program and this process, I can do all those things without any issues. So it does work, it does help, and this is reversible. But again, description below, there's a checklist for that postpartum return to running to see if you are ready to go at that 3-month mark. Okay, so then around the 6-month mark, most moms are cleared to reintroduce moderate intensity cardiovascular exercise. That's running. That's when we're at running. So the 3 to 6 month mark is a variable. Some people will be ready at 3 months. Some women won't be ready until the 6-month part, especially depending on how your birth went, both vaginal and cesarean. And that's a conversation to have with both your OBGYN, your primary care, or me, if you decide to do one-on-one coaching and working with a physical therapist that specializes in postpartum women. That's a conversation to have to determine when is the right time, when your body is healed more. But again, higher intensity is the time to help build back cardiovascular endurance and muscular strength. Again, we're back to that low impact cardio options are great, like brisk walking, swimming, and using the elliptical to start with if you didn't start at the 6-week mark or even the 3-month mark, and then gradually increasing more and more light resistance training with higher repetitions, movements like body weight squats, reverse lunges, lateral band walks. Always progress slowly and listen to your body. Now, for moms who had a C-section, it's crucial to allow the abdominal wall to heal fully before progressing to more strenuous activities. We want to avoid any direct pressure or friction on the incision site and focus on gentle core engagement and breath work. Gentle scar massage and nerve gliding techniques can also help restore sensation and mobility. For diastasis recti or diastasis recti, focus on exercises that encourage fascial approximation and core stability. So that doesn't make a lot of sense. I'm sure those are some big words, but what you're wanting to do is do more modified abdominal crunches, abdominal work. So that way we're really tightening things up, that corset type muscle, those transverse abdominal muscles, to make sure you're able to stabilize in your stomach muscles before you do any higher level things. We don't want any doming. And then through this whole process, we're also incorporating pelvic floor exercises to improve your muscular awareness and stability. Kegels, variations of Kegels, activities doing Kegels. Kegels are very important. And then as you combine these with the deep abdominal exercises, they also help enhance lumbar support and give better overall spinal stability. So it's all connected. There's a reason why there's so much emphasis in this video about doing things slowly and taking the time to heal and progress and slowly do things, because everything, your low back, your core muscles, your hip muscles, your pelvic floor, they're all connected and can all respond to issues and create issues. Not only does your pelvic floor affect your low back, but it affects your hips, which can then affect your knees and your ankles. It is crazy how much this pelvic floor and low back system and hip system can cause issues all the way down to our feet and sometimes up to our shoulders too. The head bone literally is connected to the toe bone in the world of physical therapy and the way that our body works, because everything works together. So we really want to make sure we're in good health, good stability before we start adding something super repetitive and a little bit higher intensity and higher impact that requires a lot of muscular strength, endurance, and stability to be able to do safely without causing injury. As a side note, proper nutrition, I've talked about before, but I'm going to have a whole series on that. It is vital during the postpartum period, not just postpartum period, the fourth trimester and beyond. You want to focus on a diet rich in high quality proteins, omega-3s, iron, and other essential nutrients to help support your healing and energy levels. There is a whole bunch more depth we can go into on nutrition. I am not a dietitian. I am not a registered RD. That I'm going to leave to those professionals, and we will have some video series on that to kind of go deeper into that and answer any questions that you might have. Something else that I think is regularly forgotten about in the postpartum realm is establishing a self-care routine. It's so important. You want to engage in social support networks, prioritize sleep, which is so hard to do with a newborn, but finding a system that works, and then also getting childcare assistance when needed. You need to take time away from your baby. As a mom of 6-year-old, that it's hard to do. It's hard. You want to spend every waking moment and sleeping moment with your baby. I get it, but you need time alone. That is important. And as you're working on on getting back to your fitness levels or starting your fitness to get into fitness in the first place, have someone take care of your kid for you. Have that mental, physical, emotional break to do some self-care for you and reduce the risk of burnout, of injury, of anything else. Let me tell you, I did it. I got kicked in the head basically by my big sister, who was like, you need a break. You need to take some time off. And so did my husband. And they both helped give me that time regularly at regular intervals to have some me time and work on myself, because it's important and it's something that definitely is overlooked in the postpartum world. So recovering your fitness levels, your running levels, or even starting your fitness and running routine after pregnancy requires a very strategic and gentle approach. I'm all about the gentle when it comes to postpartum. We are not no pain, no gain, go hard or go home, that type of way. Our bodies as women postpartum just do not respond well to that type of intensity. So by following these guidelines and listening to your body, you can rebuild strength safely and effectively. Remember, it's a journey, and every step you take is a step towards a stronger, healthier you. If you are still feeling like you need more help after this video and more detailed guidance on your return to running or your start to running after baby, then be sure to check out my Return to Running After Baby program that is coming soon. The link is in the description, and you can get it the early bird price and on sale today. And as always, I am also available for one-on-one coaching to help you through this time. And if you have specific problems or injuries that you're dealing with, that link is also in the description below. I offer free 15-minute consultation calls to see if this is a right fit for you and to give you an idea of what I can help you with. Hope to see you next time. Stay healthy.